How do you beat physician burnout? Well, today, a revealing live show where Dr. Maggie will pull back the curtain and understand the reasons behind physician burnout and how to fix it.
Well, a lot of you don't realize that as burnt out as you are with the medical care that you've been receiving, it's even just as hard as it is for your doctors and your medical providers, but in different ways. So today, I think it's really great and we'll go into why, but I can't wait to share with you what providers are experiencing. They've been reaching out, they've been posting comments under our lives, and providers are really burnt out just as much as you are. So I can't wait to go behind the hood, open up the curtain. We're going to explore this. Let's dig deep in. Let's go.
This is such an important topic, physician burnout. It's something patients and doctors both should care about. Thank you for joining us for this live show on Transform Table Talk. I'm Anna Manuel, the co-host, alongside Dr. Maggie Yu. Hi, Dr. Maggie.
Hello, and I'm Maggie MD. I am a functional medicine physician and MD, and I am the creator of the Transform programs. And we are now launching our functional medicine providers certification program as well. So it's a really opportune time as we're expanding, and now we're moving into provider certification to really bring this topic out. I mean, this really started from the patient side of this, and for us delivering solutions over the past 7-8 years to turn around impossible to treat invisible illnesses, where we've interacted with not just tons of patients and turned their health around, but a lot of medical providers who've gotten sick themselves.
Yes. Yeah. You've had so many physicians go through your program and then come to you and say, if only I could get the training that you offer so that I could help more people as well.
Well,
And so
they're already getting the training, because I can tell you right now, there are at least over 100, 200 medical providers we worked with over the last couple of years alone that have already told us that everything that I learned in Transform program as a participant is already impacting my practice.
wow.
We had Jay, who is a dentist, who just told us the other day that she's actually going to be expanding her training into biological dentistry, which is the functional medicine of the dentistry world, as a result of the training and the results that she's gotten with the program.
Wow. So the reach is really limitless because you're impacting that one person that might be going through your program, and then they're impacting hundreds of other people who go through their practice. That's amazing.
It is. And, here's the thing. We actually did a live, we had asked the question in our Facebook group about 2 weeks ago, and we said, what do you wish your doctors knew? What do you wish your doctors knew? And this is one of our most viral posts from the Facebook group. And if you guys haven't joined the Facebook group, make sure you join our almost at 100,000 strong Facebook group, Transform Your Health Naturally with Dr. Maggie Yu. Now, in the Facebook group, we posted the question, which was, what do you wish your doctors knew? And we talked about that. And we had a funny answer from Asif.
Oh, yes. He said, I wish my doctor knew you. Why you? Dr. Maggie, you.
And I love it. Thank you, Asif. He's one of our alumni of one of our programs. And thank you, Asif, for saying that. But the thing is that there were answers that ranged all over the place. And as a patient right now, those of you that are watching, and even as a provider, I would like, as a patient, can you type in chat, what is the one thing that you wish your doctors knew about chronic disease, your symptoms, or someone wrote anything? What do you wish your doctors knew? Because I can take a look. We had hundreds of comments. And I'm going to encapsulate some of the comments. I wish they cared. I wish they spent some time. I wish they actually listened. I wish they didn't just chalk everything up to anxiety. I wish that they didn't just tell me to lose weight and exercise more. I wish they weren't prescription pills, right? And some people even said they don't know how to diagnose or treat chronic disease. So many people are frustrated at the lack of ability of their conventionally trained medical providers in diagnosing their symptoms. And people listed what some of those things are. People said, I wish my doctors knew something about autoimmune disease. Somebody else said, what about hormone balancing? Dale said, holistic care, the cost of medication. And he's talking about the financial cost of it. What is the cost of medication on your body? what is the cost of that? And do medications actually iatrogenically cause more illness? Some medications do, and sometimes that happens. I wish my doctors knew there were alternative or other tools. That isn't just a one-stop shop. Going to my doctor means going to the prescription mill. That's some of those comments, right? Um,
Honestly.
wow. I mean, we had hundreds of comments around this, and people are just popping in. I wish my doctors knew something about mast cell activation syndrome. What about histamine intolerance? I wish doctors knew what root cause medicine was or functional medicine was.
People want to know, they wish their doctors knew more about POTS. They wish
Exactly.
their doctors knew more about PCOS. They wish their doctors knew more about long haul. There are so many that seem to be a mystery to so many doctors, but it's not a mystery to you.
And it's not a mystery for people who've gone through our programs, right? Because we are educating everyday people like you out there on how to know more than your doctors about every one of the diagnoses or lack of diagnosis that we're talking about. And comments flooded in from our alumni group. I mean, we have thousands in our alumni group, of which about 10% are actually healthcare providers in one way or another. And we had tons of comments coming in where, even as over the last 6 years, as we've been delivering solutions to these chronic illnesses, we've had clients who said, "Hey, Dr. Maggie, I wish when I got sick as a doctor that I had a doctor like you."
Yeah.
Or they have actually really started to change the practice. I can't wait to share this with my patients. This happens all the time. We have dietitianists, nutritionists going through our program. We have respiratory therapists who are like, "Wait, what did you just say about sleep apnea? I wish my patients knew about this," right? Yeah, Ciara said, "I wish my doctors knew about autoimmune disease,"
Yeah.
right? Absolutely. So we had physicians really reach out in droves. And over the years, I would say there's been, just in the last month alone, probably about 30 physicians, nurse practitioners, chiropractors reach out to us who
Mhm.
are like, "Please, please, please, like, help us. Like, I'm as frustrated as they are." And look, the truth is, I went into medicine with really good intentions, and so did all these doctors. These doctors, nurse practitioners, medical providers. We go in to heal. We go in to help people. We go in because we are service-oriented people. We are pleasers. Okay. That's at our heart where most of the healers that you're dealing with are. But the problem is that most of us, many of us have gotten to the point where we're completely burnt out because we're not in the business of healing anymore, practicing conventional, regular allopathic medicine. And
Mhm.
that's what they tell me all the time. I am so frustrated. And this is not just in the US. We have physicians reaching out to us from Canada, physicians from Australia. Currently, we have provider certification program going with providers from Canada. So it's not just US as well. Other countries are reaching out to us because physicians in other countries are telling us the problem sometimes feels worse.
Mhm.
And yet last week we were talking with two of the providers who are either going through or have been through our certification program. And Kathy was mentioning that, and Dr. B was also mentioning that, in Canada, thinking about other tools besides medicine or surgery is considered taboo. It's considered almost like witchcraft. And
Mhm.
regular doctors, even if they're like family medicine doctors who know that functional medicine is scientific based, are like saying, "But in this country, if I were to practice it, it would be considered like I was practicing voodoo medicine. I could possibly complain to my medical board. I could be investigated as being practicing out of the bounds of my training." Well, they kind of are practicing out of the bounds of the training, but
Right.
there's also a bias against functional medicine because there's a misunderstanding globally about what the hell that really is.
They're looked down upon. They're almost like an outcast if they try to take this approach. And really is so backwards, because what you are advocating for and saying is, hey, take this approach because this is what works. We know how to get to what works. We know how to get to the root cause of the problems, and
Mhm.
not just perpetuate some of those things you talked about, like prescription mills, and not having the limitations that are set in place for doctor-patient relationships, because I know that's a big complaint as well, is these limitations that are placed upon them.
Yeah, so here's something like, and I'm going to share my own story around this because, hey, I've got a lot of shame around my own ignorance when I was trained as an MD and how I treated patients coming to me who are asking for better solutions. So I'll give you an example. I'm trained at UCLA, one of the top medical schools in the country. I graduated the top 2% of my class at UCLA. I went through a family medicine residency. I was a wonderful, caring, and productive family medicine physician who became medical director, and I trained young physicians how to be better family medicine physicians. Okay. That being said, my day and the way that we practice is based on follow the money, everybody. How
Mhm.
your doctors are being compensated directly impacts on the kind of care and the choices and options they give you and their training. So what that meant was, in a day we had to see 20 to 30 patients. At most, really, we could do is try to be in face-to-face time. The most we realistically could do was maybe 15 minutes, most of the time, way less than that. And then we had to come out and we still had to do probably 10, 15 minutes of additional paperwork on each patient. Think about that. That's an 8-hour workday. In an 8-hour workday, and typically it's not an 8-hour workday. I probably worked about at least 12 to 14 hours every week because of the amount of charting that I did when I went home. So think about this: when you as a patient come into our clinic, to the clinic, you're thinking, I'm going to be number one, there's time. Number two is because this is a doctor and it's a good doctor, they're going to know all the variety of ways to diagnose, treat, or they have all the tools that they can offer me to deal with my symptoms. But I'm going to ask you out there, is that your experience, and do they?
Mm. Well,
Mm.
let me share this with you. You were talking about the time limitations and how you get paid. My son's pediatrician appointment one time lasted over 15 minutes. It lasted about 22 minutes. They charged me for 2 appointments.
Yeah, because it is volume. If your compensation is based on volume, time is money. Each new patient that you can see is money. And that is how we earn our livelihood, right?
I was blown away. I couldn't believe that I wasn't able to
Well,
talk to
why
his.
can't you believe that?
It was
Wait a minute.
jarring to me.
Why? I'm confused why you guys are confused out there. This is how you pay physicians, and then you're upset this is how physicians charge, or this is how physicians behave, because we are paying time for money. This is how we're compensating physicians. By and large, 90 in the United States, over 95% of physicians are employed. Okay. They're employed by organizations that you guys fund with your insurance companies. We are completely at the mercy of the organizations we work for and the insurance companies that compensate them. So we are slave to the clock. We are
Mhm.
slave to what we are considered billable services and what's billable and what's not billable. Is anyone surprised that you're being billed by units of time, or that you are being rushed out if you're at the end of your time?
Well, and it is just not conducive to getting your questions answered and feeling like you're going to have a solution and feel well. And, then Dale also was saying, are they compensated for pushing different tests or different medications?
Correct.
All of these play into what the doctors are up against. And it's like you said, most doctors are getting into this industry because they want to help,
I
but
did.
they're getting
Yes.
burnt out. They're getting, yes, all of the jaded with everything that goes into the medical field in this way. So there is a lot of factors working against them.
Well, here's the thing. Now you have well-meaning physicians like myself and like the hundreds of people that have reached out, providers that have reached out to us. We come down with our own mystery illnesses. How many
Mhm.
of you out there are listening that are in the medical profession, some way, somewhere in healthcare delivery, and you yourself started to come up with these illnesses and symptoms that are more challenging to diagnose or treat? We're not talking ear infection or a broken bone where it's like boom, boom, this is that. Okay. We're not talking about that. But how many of you have POTS, dysautonomia, dizziness, chronic fatigue, tachycardia, racing heart rate, hypertension, hypotension, fluctuating blood pressures, all these allergic reactions? How many of you in hormonal hell, and you're being told you're the medical provider yourself, and you start going to seek care and you're getting the care that you delivered yourselves. We're starting to taste our own medicine now, which is
Quite literally.
my job as a medical doctor with the 15 minutes I have is as quickly as possible, based on your symptoms, figure out which blood tests or radiological studies you need, and boom, next. And then
Yeah.
when you come back to review the results, you have A or B. And if it's A, you're going to get this medicine or this referral. If it's B, you're going to get this medicine or this referral or this procedure. And if it's C, we don't know. Let's get you on an antidepressant, birth control pill, or therapy. Or let's tell you to lose weight and exercise because that'll get you out of the office in 15 minutes.
Goodness forbid if you ask any questions then either, right? Because there's no time. There's just no time.
Well, so here's the thing. We are training physicians and compensating physicians and providers to be very efficient in that time frame to diagnose the quickly, easily diagnosable, that have an easy pill solution or referral solution that gets them out, right? So we are biased in a medical practice, and the conventional medical delivery system is trying to categorize everybody into this system of what I call acute quick diagnosis, easy pill solution or referral diagnosis and treatment plans.
And if that worked, great. But are people getting better?
Well, you tell me, everybody. Someone just wrote in there that they wish their doctor knew about autoimmune disease. Any of you and every one of you out there with any autoimmune disease, does this model work to figure out what's really wrong with you or to offer you any other solutions that you might need? Here's the thing. If that one pill answer or one referral cured illness, I'm thrilled for you, right? If that happened. But how many of you out there with any of these diagnoses who's been the recipient of this care, and I'm in that category of receiving this care, got the results that they needed, got better? How many of you actually healed and got better or got resolution of your symptoms or stopped that disease in its track and didn't get more and more symptoms and more diagnoses? How many of you out there, and myself included, and you physicians out there and medical providers, got the solution you needed in this type of system for these types of invisible diseases that have really almost impossible to solve symptoms? How many of you has this model worked for?
Well, and you're alluding to the fact that you've been there. You've been on both sides of this. You've been the physician working in that mill
Yeah.
environment. And then you got sick yourself and you realized there was no easy solution for you in the conventional medical world. So you've been on both sides of this and you know very well there's not a magic pill for almost most cases here, right? I know I've been through it as well.
I'm not the only one. There are
Mm.
millions of physicians around the world who are in the have gotten to the exact same place,
Yeah.
right? And so what is the solution? And I'm going to sit here to say, what is the answer? Let's talk about that. And it starts with, what is the answer to chronic diseases, invisible illnesses, impossible to treat symptoms, or difficult to diagnose things like POTS, mast cell, dysautonomia, autoimmune disease, hormonal imbalances, long haul, okay? Autism spectrum, ADD, okay? Well, it is a root cause approach, because for me, the diagnosis doesn't even matter so much as to what is the why? What is the underlying cause of these chronic illnesses? Because when you start going down and drilling down to the cause, you move beyond diagnosis and you go to the cause. If you know the why something is happening, the how and the who becomes way easier.
Mm.
But the problem is we don't have a system developed to figure out the why. What is the underlying cause of this person's 10 symptoms, let's say? It is not going to be a 15-minute visit to diagnosis. It is what I call a root cause functional medicine approach, which I review when I talk about the 5 pillars. I've created 5 pillars with which, when you think through these 5 major root causes, you can actually know the why to every single chronic illness or mystery symptom. And if anybody wants to check out the training that I did talking about what the 5 pillars are, put 5 pillars in chat. Whether you're a medical provider or you are a patient or someone with symptoms of this, put 5 pillars in chat and we can share with you what those are. Because for me, that is the root cause approach, is to think through the blocks of root causes that really fuel every single one of these chronic diseases. So diagnosis doesn't matter when you're able to have a system to go through each of these root causes. And that's what the 5 pillars of transform are. So that's why I'm like, when people say POTS, postural orthostatic tachycardia syndrome, impossible to deal with, even after Mayo Clinic, they come to me. Okay. I know, I collect them because I solve those problems. And I tell people, like, I eat POTS for breakfast. Like, meaning that's my breakfast. Give me some lunch, give me some dinner. And the reason is, when you know what the hell causes it, the why, then how you fix it becomes there could be a system that is there to fix it. And that system to fix it is, for me, the way we deliver our functional medicine. Like when you know the pillars and you work through each pillars, there are diagnostics of each pillar. There's education of each pillar and how what the root causes are and how to fix it. And using someone's data, using their education, and directly working with clients and medical providers to train them to understand each of these pillars using science and education. God forbid, we're going to educate doctors and we're going to educate patients. That's what you need. That is the answer, is to empower and teach clients and patients and now medical providers what is the root cause functional medicine approach to fix these problems from the root cause level fast.
Once and for all. And that's what I was going to say is really at its root, your program is an educational program, and it always has been for people going through the Transform program itself. So to now also have this provider certification program that is an additional level of education, because answer me this, if you would. I know there are certain functional medicine, other certifications that are available out there. What is the difference between those and what you're offering?
Yeah. When people just say, what is functional medicine certification? A lot of medical providers will come to me asking, because honestly, you're talking about a lot of noobs. 99% of conventional medicine doctors know nothing about holistic or functional medicine. So they're what I call newbies, right? Noobs. And they come into my program because they're sick themselves and they ask me these questions. I even had a call the other day from OHSU, one of the medical directors of the long haul clinic, asking like, what is a root cause approach to long haul? Because we're not helping people as much as we can. And why are you seeing these stunning results? And as I was going through it, it was like, it was a great conversation. And I love providers when they reach out. But the truth is 99% of providers are newbies when it comes to functional medicine. So what they're looking for is, how do I get trained on this? And they are looking for sources for certification, meaning like learning. How do I learn how to do this? So there are organizations like Institute of Functional Medicine, IFM, that provides provider certification. There are trainings that are headed more by naturopathic training groups like A4M, other types of trainings that providers can get. I've been to all of those. Okay. And I am an IFM certified functional medicine provider. But here's the deal. I got into this way before that. So because by the way, I'm 54 and I really came down with these symptoms when I was 30, right after the birth of my first child. And so based on my own disease and symptoms at that time, the inability of myself to help myself, the inability of my colleagues to help me, I had to get out of the box and find my own solutions to save my own life. And that's how most of us get into this, right? And so as a result, I went into this before there were certifications available, to be honest. And so I had to learn from naturopaths. I had to learn from compounding pharmacies. I reached out everywhere that I could, and I got a lot of training and I started to work with patients on it. So right now I'm 54. I started when I was 30. So we're talking, 24 years of doing
that you've been at this.
Right. And so for me, before there were certifications available, I was learning and putting it together for myself, but I had a lot of patient experience. It's because once the word got out, I was in Portland at the time, and as a family medicine physician, I started learning about bioidentical hormones from my early menopause. I started to realize that I had Hashimoto's and other autoimmune diseases. I collected a medical practice with 12,000 patients and had one of the biggest functional medicine clinic at the time when that didn't even really exist.
Yeah, they were just coming to you because there was nowhere else, and you at least had the answers. You at least had results that were starting to show from all of your hard work and researching what to do at a root cause level.
And how I did it was I hired a bunch of primary care providers and I hired an equal amount of naturopathic physicians, and we learned together. We had case studies, case reviews. We worked side by side on the same patient cases. Most of our patients not just saw one of us, they may have seen one of us for their pap smear and for some of their regular routine visits, but an ear infection. But then they'd be seeing our naturopaths, and I was doing both. So it was really incredible way of teaching each other collaboratively to develop what is a functional root cause medicine approach that integrates medical practice that's scientific based along with holistic options that are also scientifically based.
Mhm.
Okay. That's what functional medicine really is. And so I created literally my own certification in my own clinic by trying to meet the needs of these patients in our functional medicine clinic.
This was
And
20 plus years ago that you were pioneering this.
correct. And what I found was later when you had certification programs open up, I went to get certified anyway because I like letters behind my name.
Sure.
So but when I went to, for example, IFMCP means Institute of Functional Medicine Certified Provider. And there's 1 year, 2 years, however many years you want to go through that process to learn. But as I was going through and learning, I realized that I'll give you an example. You think that somebody going through IFM to get trained on hormones and they show that they've been through the hormone part of the certification program, you think that's a lot of training and experience. Well, it was a mostly all lecture training, like I think about 6 to 7 hours a day, maybe about 3.5 days, and that's it. No direct patient contact, no mentorship, no hands-on experience. And many of these functional medicine providers weren't MDs or nurse practitioners or even prescribing. So it was some of these things they would never be able to practice in real life. And so while there are institutions that are creating trainings and people are getting certifications with it, it is challenging for a lot of those young providers or providers going to get that training to know what the heck to do when there's real world patients that are coming in and cases and labs coming at them and all this stuff. And they had all these other chronic disease or mystery illnesses complicating it. What the hell are they supposed to do with people? So,
And I just want to say, you mentioned that they didn't have any real case studies to work with, real patients to work with. When we spoke last week with Dr. Beatty, he was mentioning
yeah,
that in the short time that he's been in your certification program, he has worked with tenfold more patients than like over his entire career. It
yeah,
was some kind of comment like that. And that's just because the volume of people that you see is
yeah.
enormous. And that is hands-on training, much unlike what it sounds like you get when you're getting these official IFM certifications.
Right. And in our official certification, when you're talking about that, for me, like one of the most important things is I really think that doctors, like noobs, trying to get to become a physician like me who's had, what I'm a 27-year practicing physician. And, so when you're looking at the number of years at this point, I'm clocking over probably 12, 13,000 clients I've worked with directly and have supervised as well. This is a lot of wisdom and hands-on clinical practice. And not only do you get to see, okay, I'm really proud of our programs. We have hormone programs, my hormone masterclass, hugely popular. We had a digestion and food mapping program for dealing with food allergies, mast cell histamines, and it's called My Food Mapping Masterclass. We have a thyroid masterclass program for people dealing with thyroid issues. And we have an entire program, the main Transform Fundamental program, that deals with every single pillar that we're talking about, dealing with impossible to treat illnesses like POTS and mast cell. Now, because of that, I've collected a huge amount of patients and clients that we work with from around the world. So in a week, just looking at how many hormone reviews we do live with live clients with their real histories, real symptoms, real learning with them and troubleshooting with them, and with real instructor teams and myself mentoring you, like the number of hormones you review and review and troubleshoot in a real client in a week is more than what someone in a functional medicine practice would go through in a year.
In a year. And so just so I understand better, when a doctor or a physician or somebody who is trained in functional medicine is wanting to come to you for certification, they are actually getting to experience that. They're in there with you, watching these
Yeah.
live. Okay.
Yeah, so here's the thing. It's a 6-month certification program and it is immersive. And the way that it's immersive for me is the first 2 months you're going through our programs.
So they get to go through it.
They have to go through it. How do you deliver care and teach when you haven't gone through it as a recipient yourself?
and really understand it from the inside out.
Absolutely. So the physician certification as they grow through, and we've already had groups go through, and we're just now launching it in the last month officially. But we've already had groups of certification beta go through our certification process. And what we found was this: you have to go through our programs. So included in the certification, first 2 months, you're participating as a full participant. And I can tell you right now, Dr. R, who's going through right now, I mean, I wish we could pull up the quote of what she just said on her first mastermind call, watching through the training, just as troubleshooting in our main Transform Fundamentals program. She was like, I mean, maybe we'll pull up the quote. If somebody can pull up the quote, we could even share what that experience is like as a recipient. And as a recipient, she's receiving it and experiencing it, which is your best learning tool, number one. And then in the next, and then after the first 2 months, as a recipient experiencing in the program, that then there is direct education and training on how do you teach patients? Like, not only do I learn these skills, but how do I now, because for me, how we teach doctors is see one, do one, teach one. Okay.
Yeah.
So if you're actually see one, do one, you could see and observe, be an observer of these, but do one means you yourself are doing the program. And then number 3, you got to teach. So it's a functional medicine instructor certification. I am actually spilling the beans on how I teach patients, how I would teach a doctor to teach patients this.
Well, and that sounds like a critical aspect to this. It has to be, because if it's all about empowering the patients, they have to have that education. So you have to know how to properly provide it to them, which is what you go through after they go through the program.
So do you know that the Latin root for the word doctor actually comes from the word teacher? Doctors initially were teachers of teaching people how to care for their health.
Not just writing a pill and having you on your way, but actually
now doctor means prescriber. Who's your prescriber? Who's your referrer? Who's doing your referral? Who's doing your billing? like really, like doctors are teachers. And one thing, the most important thing I've learned with every program and every person that I've ever impacted, the reason that patients get results is when the doctor becomes the best and finest teacher they know how to be. And that skill, when the doctor knows how to teach it, patients receiving the education is how they get freaking empowered, and how they get all these other tools, and also how patients break free from what I call a dependency model versus an independency model. Every one of our programs is teaching skills.
And you've seen physicians who have gone through the program and then apply the practices that they've learned on their own practice. You've seen their practice transform truly into the outcomes that the patients are receiving, the referrals that they're getting, and the more people coming in their door saying, hey, I heard that you're the best at this.
Correct. And so, like, I remember just speaking with June. She was a physician assistant, I think ear, nose, and throat. And she was talking about, as she went through the program, and she's a physician assistant being employed in a medical group. She was saying how, doctors in her practice now were sending some of in an ear, nose, and throat practice, their vertigo patients, their dizziness patients that were impossible to solve. They're like, oh, maybe June needs to take a look at her hormones. Like, oh my God, like this is sacrilegious. Hormones have something to do with someone's vertigo?
What are we talking about?
Or their Meniere's disease? Yes, and hell yes. So it's really cool. We have medical providers who've gone through our program. They tell me, even during the program, they're like, in my medical group alone now, I have developed the skills and the reputation of being able to solve these difficult to treat problems. I've become a mentor to some of the other people because, wow, I had another person. Kimberly O. If you're out there, Kimberly O. just finished our Transform Fundamentals program. She manages a chiropractor office, and she works with a chiropractor who, by the way, bless his heart, everything that she's been learning, she's been sharing with her chiropractor, and her chiropractor has come to her over and over again with certain types of cases and said, you know what, I have this patient who has ABC. What do you think Dr. Maggie would say about this? And Kimberly said, I know what she would say about this, and she's sharing. And they've been getting my books off Amazon
That's a
and
great way to
sending
start.
it to their patients. And I just sent Kimberly O and her chiropractor a case of my book, 8 Hour
Oh,
Ways to Transform Your Health, because
there you
they've
go.
been buying my books off the shelf off Amazon. I said, I just talked to Kimberly the other day. I'm like, hey, Kimberly, I'm going to send you guys a case of my books. She's like, what? I was like, yes, thank you.
This will
Thank
help so
you.
many people.
Right? So I love, like I want everyone out there to know these are your healthcare providers. There is a percentage of them that get it
Mm,
and they want to know how they can learn to do this and how they can help. And what's so different about how we do it, our clients know this, is I teach skills.
yeah.
I'm teaching skills. I'm not sitting here with a slide presentation only and be like, oh my gosh, we have 3.5 days to teach you all of these things, and no hands-on, no personal experience. I want every single provider going through our certification to experience the programs, number one. Number two, to get direct education and mentorship from me and our instructor team on how to teach and deliver these programs and education to your patients. I am giving providers the tools with which they can say, you know what? Maybe I want to apply this to my one-on-one patient practice, or maybe I want to become somebody who's able to teach through social media or
Mm.
online programs to reach more and more people, not just in my geographical location, but everywhere, right? So there are providers who are like, I want to think about maybe taking my practice online or starting a program like Dr. Maggie has with Transform, where I'm teaching patients skills. How would that transform a practice and a physician's life when he or she becomes a teacher and
Mm.
a mentor to themselves, to their patients, and to other practitioners?
And
That's
how many people could
skills.
they help? How many more people could they help? And that brings up an interesting point. Somebody had a question, do you work with people in England? That was
Yes.
a question that came in the
We
chat.
just enrolled somebody from England, just so you guys know. So
Well,
we're
and you work with people from anywhere in the world, and that's the beauty of this. If you're anywhere in the world, you can enroll as a participant and transform. But can any physician that wants to take part also enroll from anywhere in the world?
In fact, I have more physicians, just as many physicians reaching out from other countries as I do in the United States. And part of it for me is I'm beyond borders. When I am an educator and I'm a teacher, you guys see what I've been doing here is teaching and I'm talking, right? And when I teach, I am an educator and I'm a teacher. When a physician becomes a teacher,
Mm.
then we become crossing global lines. We cross geographical boundaries when we become teachers. Because can I work with a client in England on teaching them about thyroid?
Yes.
Can I work with a client in Zimbabwe with POTS where they have no access to doctors who even know how to diagnose it or treat it? Can I teach this client skills?
Check. Yes.
Yes. So the answer to my own physician burnout was to teach.
Mm.
Was to teach. When I realized that I could use an online platform, social media platform, to really sharpen my skills and build my skills as a teacher, then suddenly, like, that transformed my world and my life.
Yeah.
And it transformed patient outcomes.
And then it brought you back to why you were in this in the first place, to help people. You were back to really helping people.
Yeah. The more I became a teacher and really owned that identity, and invested my time, energy, and focus, because I got training everywhere. I mean, over the last 27 years, I've been trained by the most wonderful, acupuncturists, chiropractors, naturopaths, and medical doctors. And this is how, over the years, I've been able to do that. I have had some really good mentors and teachers who taught me in their very areas of specialty. And now I love the fact that I've been able to use it to deliver a comprehensive functional medicine model to patients, but also to providers who want to learn how I do this, right?
Mhm.
Education is the answer to some of the limitations that we see in our medical practice and in even some of the country and cultural aspects of care. Let's move beyond borders. Let's utilize and hone our role and our education as teachers. And we can cross geographic lines and also change how we practice, whether it's one to one, or how about one to many?
Yeah.
Like, how many people have I been able to impact in this video alone, right? This one time, this last, 40 minutes of my time, how many people are going to be seeing this video? How many people are you going to share this with, right? And anybody, if this resonates with you, in the comment section, tag somebody you know that really need to hear this. How many physicians do you know that went into this for all the right reasons, right? And are stuck in a system for all the wrong reasons, right? And really want to wait out. And they don't even know that what functional medicine is. They may not even know what a certification is. And number 3, they certainly don't know what this functional medicine instructor certification is about. And they need to, right? I would love for you guys to share this and put their names, or even click the link and share it with them, whether through a text or through Facebook or YouTube. I would love for you guys to share this, because we need an answer to physician burnout. We as physicians are just as mad and just as sick and just as frustrated as you are with the lack of answers to chronic disease and our own physician burnout. We are working in a system we feel like we're a slave to. We are clocking in and clocking out, and we have to bill you an extra visit after 15 minutes, because this is the system you guys and insurance companies and hospital system have determined how physicians should be compensated.
Right.
We are a victim in that system as well. So for me, I got out of it. I had to jump out of it. I teach now. And I impact hundreds of thousands of people every single year. And we teach physicians how to impact hundreds of thousands of people every year of their lives.
So why not, if you are a physician out there who is feeling some of these same stressors, who is feeling the extreme amount of burnout, or you know somebody who's in the medical field who's also feeling this sounds like, why not check this out and understand ways out of it, a way to get out of the burnout, a way to be a teacher, a way to transform your practice in some way, shape, or form, whether it's continuing the same traditional seeing patients or moving to an online platform, which sounds like something you address during the 6 months that you get to spend with these practitioners.
Absolutely. And people ask me, what kind of providers do you think would be great to become instructors in functional medicine? And I'm going to say definitely MDs, definitely nurse practitioners, definitely naturopathic physicians, chiropractors. I have functional nutritionists reaching out to us with that. There's a variety of different types of providers that could really benefit from this kind of training. But your goal needs to be, I want to become a damn good teacher of this. So it's a functional medicine instructor training program, and it's a certification for that. So it's very specific and unique. I'm pulling back the curtain. I'm teaching my secret sauce for how I teach. That's the key that's been so missing, I think, from functional medicine training, is the better you are at being a teacher and an instructor, the more your career and practice options really open up, and the bigger the impact that you have on your clients.
It's amazing. And I'm also curious, people want to know, do you have to specialize, or can you specialize after working with you in one particular ailment? Because somebody here said, Dr. Maggie's truly brought hope back to my life 5 months ago. Working with POTS, would be lying if I said I never cried. I didn't know anything about POTS, but Dr. Maggie helped me understand. And this is the kind of stuff people think, POTS, you can't cure it. But
Yeah.
what do we know? You enjoy it as your first meal of the day.
I really do. Give me some mast cell for lunch. Give me some impossibles to treat Graves or Crohn's. Throw me some Crohn's for dinner. But Alex, that's a good example of somebody. He's not even in one of our programs. He's been watching my content these past 5 months, and he now knows more. I promise you, because I know how many lives you've been on, Alex. He knows more than all his physicians combined about POTS, postural orthostatic tachycardia syndrome. Say that 10 times fast. I can, and I will. But Alex, and this is the power that education have that clinical medicine doesn't have, right?
Right.
And so, and when you combine that with a deep, deep lived in comprehensive understanding, being a recipient and a deliverer of root cause functional medicine, that becomes honestly like nuclear. That becomes nuclear in impact and the power in which you can transform your practice and the career options that you have.
Yeah. I've got some testimonials here. I want to just go through quickly. And Roxanne says, I've been following Dr. Maggie. Just listening to her makes me feel like I'm healing. Reading her book also makes a positive difference in my life every day. And Dr. Maggie,
Mm.
I do have some provider testimonials, if I may. Did you want to comment about that last comment
Okay, let's
first?
do it. Let's see what some of the providers have said going through our program.
So we have Amy, who is an RN, saying, after going through the program, I completely changed the way I assess and help my patients, leading to health turnarounds that used to be uncommon, but now happen all the time. Used to
Amy,
never see these kinds of results.
Amy is AMIE, and she has done several interviews with us. She's an RN who almost had to quit her job as a result of her POTS. Okay. And so for her, she's had several interviews with us, and this has transformed her life, her family's life, her practice.
And
Like,
her patients' lives. Yes.
yes, tons. I mean, so for me, thank you, Amy. And yeah, lovely. Anybody else?
Yes, we have Christine, an NP or nurse practitioner. I will be forever grateful to Dr. Maggie and
Mhm.
all the dots she connected for me. My practice is now thriving. My patient outcomes are incredible, and I don't feel like I'm always bordering on burnout.
Yeah, yeah. I remember Christine came to me about 4 years ago, and absolutely. I also think that interestingly, the family nurse practitioner training lends itself really well to become functional medicine provider.
Mm,
I think there are specific specialties that are more generalized that actually makes them better functional medicine doctors because they know a little bit or a lot about a lot of things. And so you had started the question about should people specialize? We'll talk about that more in a sec. But I think, for example, family medicine doctors, general internal medicine doctors, pediatricians, I think actually that particular group or physician assistants that are in general practices under those specialties, that generalized experience, like, and I have a Lisa who's gone through a program and she was family
She went
medicine.
through undercover. By the
She
way, we didn't even know she was a doctor at
We did
first.
an interview. She didn't tell any of us that she was a family medicine physician. And, you know, it's so cool when I have quote unquote colleagues going through the program because immediately they tell me what an impact this has had on their practice. So, Christine, for her, like getting trained on hormones, even after many years as being a nurse practitioner, getting trained on hormones, adrenals, and seeing me troubleshoot all these really hard cases, including hers, she was like, okay, game changer. Thank you so much.
I have two more, if I can share two more with you. This is from Alice, a FP or functional practitioner, I assume.
Family practitioner.
Family practitioner. Okay. As a one-to-one clinician, I never understood or knew the power of being educated and
Yeah.
knowing how to share that with my patients. This is what you've been talking about. I
Well,
now dream and live a much bigger dream.
yes, that's the thing is, you know, and you know this in the fundamentals program, which you went through,
Yeah.
one of the mindset work that we do in there is creating a dream board. And it's intentionally around almost near the second month of the program, end of the second month of the program. And this is for patients, for clients. And people in the beginning, I don't ask them to do that dream board exercise because they can't dream.
Right.
And when you're burned out, hopeless, frustrated, mad, feeling gaslit, you feel like a victim and you certainly cannot dream. Well, doctors are in the same boat, medical providers are in the same boat with their medical practice and sometimes with their own illnesses as well, oftentimes. And so for me, like that was what really struck me about Alice when she did her dream board. And her dream board, I mean, on it, like had much bigger dreams. And I say this to patients, like, because when we talk about somebody coming in the program, sometimes they're like, I just want my hair loss better. Right?
That was their goal.
How's it go? Get my hair loss better. How many, I don't know how many alumni are watching right now who've been through the program and they're like, if my hair loss went from a level 9 to just a level 3, I'd be thrilled. I'm like, girl,
I do so much more than that.
I was like, dream a bigger dream.
Yes.
And but they're like, I don't even think, like, you really think that my dizziness could be gone? You really think I could sleep through the night? We talked to someone the other day. She was like, if my hair loss was just half, I'd be thrilled. I'm like, how about your insomnia that you had for 20 years gone by end of September?
How about your dizziness gone? How about your digestion completely turned around? You're like, what? I can do all of that. How about I
Yeah.
interviewed somebody the other day who got off blood pressure medication by just going through your program, and that was not an expectation they had going into the program.
Right. So for me, like once there's a, so you said somebody in chat was asking about like, can I go into functional medicine certification and can I specialize in the area? And I say yes. And the most important thing though is this is the problem with how we train functional medicine providers is that they don't get the full 5 pillars of all the fundamentals and they don't get hands-on practice with all of it. So most of them specialize and niche down really fast and they become good at one little tiny wedge. I'm the expert in SIBO, I'm the expert in mold, or I can do this one thing. And for me, that is not a comprehensive root cause approach to many of these difficult to solve problems.
Mm.
So as a result, for me, this training around all these fundamentals is critical for you to get the hands-on understanding and training of how these pieces work together. And so if you want to do that for dealing with all these complicated illnesses later as your career choice, great. But if you do that and you say, you know what, I really love the digestion piece and I want to become the expert on digestion. And I also understand how digestion fits in with all these other pieces, but I want to practice in the area of digestion and food allergies, do it. Do it. It's your prerogative. But get the training of comprehensiveness first and how these fit together before you do that. So you're not dysfunctionally just looking at just one piece. And this is the be all end all of everyone's problems because it ain't. All these pieces and how they fit together is the solution.
Oh, it is. Well, we have a final comment from somebody who is, I believe, enrolled in your physician certification program right now. And as you come back in the room, I'll just go ahead and read it. This one is from Tasha, an
Aw.
FMP in the program right now, right,
Mhm.
Tasha?
I think
She
she's
said,
a family medicine physician.
okay. She says, walking through results and treatment approaches to different people's symptoms is gold for me. Such an efficient way for me to learn. I left excited, realizing that this program was going to be even better than I expected.
That was her first call. That was after her first call. This was a couple weeks ago.
One call.
That was after Tasha's first call. This is just the first time as a participant on her first call, just watching this and receiving the content for the first time. So yes, so I love that. Thank you for sharing Tasha's experience. So important, everybody, for me is real people and real outcomes. So what you're going to be hearing from me is exactly what is happening behind the scenes. And there's tons of case studies and testimonials for every single diagnosis and case that we deal with. And what I would love to do also more and more is I would love to be able to share more and more of the providers who are going through our certification, the real experiences with you. So if you guys like this, in chat, you want more, more provider feedback, more testimonials, or more exploration of another topic that I discussed, because I really pulled the behind the scenes curtains for everybody here. If there's something more that you want to see, if there's a question about anything that I talked about, put it in comments right now, because I am going to deliver more and more content and answers, because I'm going to teach this topic live every single week. We're going to be teaching on all these different topics. So if there's anything that I didn't cover or you want to be covered in more depth, put in the comment section because I will deliver.
And yes, today it was so exciting to learn a little bit more about what is offered in your physician certification program. I know there was a lot of comments coming in asking you to address client and patient concerns as well. And yes, we do that all the time, and we will do that. Dr. Maggie reads through all of your comments, so rest assured that they did not get typed out in vain. She will take a look at them, and then she uses that to help understand what she's going to talk about in the future. So yes, people wanting to know about their specific ailments and ways to help that. And this, just because you have a physician certification program, you still have all of these other programs that you mentioned for client and patient outcomes that you can go through.
So here's the thing. If you want to learn more, so I'm going to tell you guys right now, pay attention, everybody. So get ready to type in the comment section. So if you want to learn more about POTS, I have a free multi-part training series that I can take you through for free about POTS. So if you want to learn more and you want to hear me teach about POTS, and why I eat it for breakfast, put POTS, please, in the comment section. We will get you a free training series that I created with these lives and about POTS, how to end POTS, dysautonomia, or long haul. All you have to do is type in chat is POTS, please, and
There
we'll
have
do
been
that.
so many comments, by the way, saying, please,
Okay.
let's talk about POTS. Yes.
If you have mast cell or histamine intolerance or all these food trauma and food reactions, type food freedom in the chat right now in the comment section, because I have a multi-part training series about food freedom, mast cell, histamine intolerance. I love it. Thank you, Gemma. Okay. And yes, we see all these comments and we read every one of these. And then if you are interested in learning more about hormone balancing, we also have a comprehensive hormone guide and a checklist of hormone related symptoms at every age. And whether you're a man or woman, we have a hormone guide. Put hormone guide in chat. Now, if you want to work with us as a patient on anything, as a client on anything, we're also going to put a link for you to book a chat with our team. So if you've watched through this whole thing, and many of you have watched through many of our trainings, you know me, you know what we are. And if you're ready to turn around your chronic illness, invisible illness in any way, just book a chat with our team. We opened up an additional 40 spaces just over the next 3 days so that we can accommodate the number of people that are going to be booking, wanting to talk to us, so we can learn more about what's going on with your health. And if you are a provider looking for certification, then I'm going to share a link in chat. And we are going to be just click the link, and there's going to be a lot of information to learn more, and there's going to be an opportunity to submit information. And we have questions to ask you to learn more about you, to see if it's a good fit for me to train you.
I love it. And what an amazing thing that you're now offering. I know it has been much requested over the years as physicians have been steadily coming through your program and saying, if only there was an additional portion of this to be a actual certified, transformed, trained by Dr. Maggie, you herself, instructor. Well, now you got it.
Now there is, everybody. That was wonderful. Thank you for sticking around and commenting all. That was a lit chat, everybody. And I'm going to read every single comment even after this. So if you're watching this anywhere, feel free to comment, because I read every comment. And make sure you check out all the links that we talked about we're providing here in chat with some of the resources. And then if you're a provider looking for certification, there's a link right there to get in touch with our team.
Okay. Thank you so much, Dr. Maggie. We appreciate it.
Have a wonderful day, everybody. Thank you.